Good morning to all our media partners, CHDs, and everyone who is watching on YouTube. I am Jolo from the DOH Communications Management Unit, and in our Kapihan today, we'll have the COVID-19 situation and some biosurveillance updates. Here with us today is Director Aletea de Guzman from the DOH Epidemiology Bureau. Good morning po, Dr.
Magandang umaga, Jolo, to our senior team, and of course, to our media partners. Shall I go on, Jolo? Okay. Sige. Let me just share my screen. So, this morning po, gusto lang po namin magpaabot ng kamusta na ang ating COVID-19 situation. At yan yung paninimulan ko with our biosurveillance updates. But before anything else, I'd like to start off with these three key messages. Una ay ang pagkakaiba ng kaunti ng nakikita nating pagdami ng kaso nitong Agosto kumpara nung Abril. Kung nung Abril, ang karamihan ng mga kaso natin ay nanggagaling talaga sa ating NCR plus areas. It's actually more challenging now because the increases in cases is not centered on that area alone. It's actually across whole of Luzon and selected regions in Visayas and Mindanao. Sa ngayon, nakikita nga natin na karamihan ng ating mga probinsya ay naka-alert level 3 at 4 na. At karamihan po sa kanila ay humihigit na ng 70% ang kanilang bed and ICU utilization. Nakikita natin ng tuloy-tuloy na pagkaroon ng detection natin ng Delta at noong nakaraang araw, tayo ay nag-announce ng community transmission ng Delta para sa National Capital Region at Calabarzon. Pero gusto rin namin ipaalala na even with this confirmation of community transmission in these two regions, we have actually already set in place essential actions to respond to these variants of concern upon the detection of our first local Delta case. And yung huli ay yung pagpapaabot uli ng ating nakita sa ating mga projections na ang ating mga community quarantine, a higher wide-scale community quarantine ay nandyan lamang para bumili ng oras. And the core strategies are really our vaccine deployment, improving case detection to isolation intervals, and the last is our adherence to our minimum public health standards. So, paniwalan ko po sa biosurveillance updates, so we will already detect 2 VOCs in all regions. Sa ngayon, BARM na lamang po ang hindi pa natin na dedetektan ng local Delta case. Yun ay maaaring dahil sa kaunti pang samples na nakukuha natin from that region. At yung ikatlo, yung pangangailangan nga na tuloy-tuloy na pinoprotektahan ng ating mga ports of entry dahil halos higit sa kalahati pa rin ng ating mga nasisequence na samples among our returning overseas Filipinos ay positibo para sa isang variant of concern, be they Alpha, Delta, or Beta. Madalas nakikita nyo yung cumulative na proportions ng ating mga VOCs. Kalahati sa kanila ay alpha at beta na at umakyat na nga sa higit 12% ang ating delta. Subalit kung titingnan nga natin yung progression ng mga positibong samples for VOCs, nakikita natin dito sa graph na to at yung mga red na mga bars ay ito yung mga variants of concern. The darkest is the alpha, followed po, yung a little bit lighter is beta, at yung pinaka-light and the ones found usually on the rightmost is delta. Anong gusto nating ipaabot dito? Kung nung tayo ay nagsimulang mag-sequence noong Enero, nakita natin napakaliit lamang ng proportion ang tinitake up o nagpo-positibo sa mga variants of concern na to. Simula ng unang linggo ng Pebrero, ang ating mga samples ay unti-unti nang tumaas ang percentage nila na nagiging positive para sa Delta, Alpha at Beta. Pinaka-recent, nakikita din natin na yung pinakahuli natin mga runs ay karamihan na dito ay mga Delta. So madalas kasi tayong tanungin, dominant na ba? Predominant na VOC na. Ang isang caveat ko dito sa pinakikita nating graph ay ang paghanap kasi natin at pagpapili po natin ng ating mga sequences in a way is biased towards detecting these variants of concern. Kasi ang purpose ng ating whole genome sequencing ay kapag tayo nakakita ng pagtaas ng kaso, pag meron tayo mga severe critical cases or deaths, or nakikita natin na meron tayo mga naulit na infection, gusto natin masagot yung tanong na meron kayang variant of concern na pwedeng magpaliwanag doon sa nakikita nating event, no? Kaya naman, yun yung ibig nating sabihin na mataas talaga yung chance na yung ating mga nasisequence na samples ay positibo talaga para sa variant of concern. Nakikita natin dito na para sa National Capital Region, which is the graph on the left, at para sa Calabarzon, halos pareho, no? Yung nakita nating pattern. Pebrero, kung hindi karamihan, may mga linggo talaga na halos lahat ng ating mga nasisequence na samples ay positive for either the alpha, the beta, or the delta. So with that in mind, anong epekto nitong pagdami ng mga VOCs natin locally? So yesterday, we reported 13,573. And what I'd like to point out here is number one, sa pagdami ng kaso natin, tumataas, no, yung proportion ng mga active cases natin, which as of yesterday is already at 6.66%. Marami rin naitatanong about our deaths. Sa ngayon, pag tinignan natin in total, ang ating cumulative case fatality rate ay naiiwan lamang at 1.73. At titingnan natin yan later. And when it comes to our top regions and top areas with cases, naiiwan naman po palagi ang NCR, Calabarzon na 3. Subalit nakikita natin, no, yung top 4 and 5, no, kung hindi man ito mga regions sa Visayas or Mindanao, and there are days that we're seeing regions such as Cagayan Valley na nasasama, no, sa ating mga regions with new cases. At pagdating sa ating top areas, bumabalik tayo na these are mostly areas coming from the NCR plus po natin. This is now how our epidemic curve looks like. And this has been what we're flagging that in the next days and weeks, we'll probably seeing additional peaks. No? Bakit ngayon tayo, parang hindi pa tumitigil yung peak? Kung titingnan natin yung unang peak natin ng Abril, it really took us several weeks before we reached that peak in the first week of April. Cases started to increase mga unang linggo, dulo ng Pebrero hanggang unang linggo ng Marso, at tayo nagsimula, no, sa our lowest numbers then, which were around 1,500, just under 2,000. Pero tayo ay nagsimula kasi ngayon ng around an average of 5,000 cases per day. And we will really see, no, as we haven't yet felt the full effect of our ECQ, there is really a probability that we will still see additional, no, cases. Pero kung nakita nyo kanina, ang binabantayan natin ay mga proportion natin ng severe or critical na ngayon ay umaabot lamang ng under 2%. Nakikita din natin dito na from NCR contributing the lowest percentages, lumalaki po talaga yung contribution niya at siya yung blue bar dito, followed by Calabarzon, which are the teal bars, and the yellow bars, which are our region 3 cases. We're now averaging 15,537 cases per day, which is higher, no, than the 12,897 that we reported the week prior. Kung merong pagtaas nationally, ito din ang nakikita natin sa bawat island group natin. Subalit, kung titingnan natin yung 5 linya, ang may pinakamabilis talagang pagtaas ng kaso ay ang NCR+, which are the blue and the green lines. At kasabay po nito ay yung rest of Luzon, which is the red line. The others are also increasing, pero kung mapapansin nyo, very, very slow para sa Visayas region, which is the teal line. At para naman po sa ating Mindanao, meron ding pagtaas. Subalit, hindi kasing bilis ang nakikita natin dito sa Luzon. Nationally, we remain at high risk. At makikita natin na ang is slightly higher, no, than the 2-week growth rate we saw 3 to 4 weeks prior. We're at 63% this recent 2 weeks and 58% po in the 3 to 4 weeks prior. Nationally, our bed utilization is at moderate risk at around 64%. So balit tayo maabot, no, ng high risk para sa ating ICU utilization rate. Meron din tayong 10 region kung saan nandun din sa high-risk case classification at kasama nga po ang National Capital Region dyan kung saan nakapagtala tayo ng 83% na 2-week growth rate, which is slightly slower than the 137% that we saw the 3 to 4 weeks prior. I'll talk about NCR a bit more later. At katulad ng ating national healthcare utilization, naka-moderate risk din ang kanyang bed utilization. Subalit, naka-high risk ang ICU utilization para sa National Capital Region. What we'd like to flag are Calabarzon, Region 3 and Region 2 kung saan parehong bed utilization nila, lahat ng kanilang bed utilization ay naka-high risk na at makikita natin no, na humihigit 80% ang kanilang ICU utilization rate. Ngayon, tingnan natin si National Capital Region. So what's interesting about NCR is it actually almost went down after it peaked in April. The numbers swiftly went down. And ngayon nga, yung kanyang pagbaba ng kaso is halos kasing baba na nakita natin noong January at February. Kaya naman, yung kanyang pagtaas at yung level or the number of cases, hindi pa tayo actually umaabot sa peak natin ngayon. At itong nakikita natin na para bang there's a perceived slowdown. We're now averaging 4,105, which is a bit higher than the 3,533. So are we seeing na bumagal na talaga? Ang caveat ko dito na is this is a very short time period to say that bumagal na talaga. No? Remember, we are ramping up our active case finding. We're also encouraging our LGUs to, of course, with more cases being found, to increase their testing and contact tracing. No? So, posibleng may pagtaas pa tayong makita dahil nakakahanap tayo ng dagdag na kaso, nakakahanap tayo ng dagdag na mga close contact. We always say that if we want to declare na talagang bumaba ang mga kaso, it shouldn't be just one period of time. It should be a continuous decline na nakikita natin, whether it's a slow decline or a fast decline in our cases. So, kailangan pa rin na tuloy-tuloy ang ating mga response activities so that we will see not just this parang bumagal, pataas pa rin siya. It's not even a plateau. So kailangan tuloy-tuloy pa rin ang ating mga interventions. Nakikita din natin ngayon that all cities and the one municipality of the National Capital Region is still at high-risk case classification. No? May lahat sila ay positive pa rin ang 2-week growth rate nila. And I guess the reason why we're flagging na we cannot be complacent is we're also looking at their 1-week growth rate. At makikita natin lahat ito ay positive pa rin. No? Pataas pa rin nga yung kaso. Siguro, albeit a bit slower than the growth rates that we have previously seen. What are the districts? What are the districts where we're seeing higher utilization rates? That's District 2, whose bed utilization is now at 79% and their ICU utilization is at 81%. For District 3, both bed and ICU utilizations are actually at moderate risk. At sa District 4, naka 70% bed utilization, which is just under, no? Yan po yung upper limit natin for moderate risk, and an 88% ICU utilization. It's only District 1 nakakita tayo na though moderate risk ang kanyang bed utilization, naka-low risk, no? Naka 49% lamang ang kanyang ICU utilization. No? Sa ngayon, doon sa 14 na lugar sa NCR, 3 lamang ang naka-alert level 3 at yan nga ay ang Caloocan, Mandaluyong at Manila, but the rest are under alert level 4, which means that on top of increasing cases, we're still seeing bed or ICU utilization reaching more than 70%. So, to summarize the areas in alert level, wala na po tayo sa ngayon nakita na alert level 1. So, kung i-analyze natin na bakit naka-alert level 2, 3, or 4 na lamang tayo, sabihin, even though there are areas tulad ng nasa alert level 2 na naka-low risk lamang ang kanilang case case classification at hindi pa po tumataas ang kanilang bed or IC utilization, meron na tayong nagsisimulang pagtaas, no, ng kaso na nakikita, at ito yung oportunidad na kung anumang pagtaas yon ay sana mapabagal or matigil na natin para maibalik natin sila sa alert level 1. Kaya lang the challenge here is that more areas are actually under alert level 4, and that really spreads thin our resources. And as you can see in this list, there are really regions that if not all, then most of their areas are under alert level 4 na. So kaya mahalaga yung pagpa-prioritize, pag-aalam, paano ba natin talaga sabay-sabay, no, na i-address yung pagtaas ng kaso at ng ating mga utilization. And for our mortality, we're seeing our deaths per day increase. No? So after the peak of 135 deaths per day in April, it slowly went down, and the lowest was last July at 94. Subalit as of August 25, tayo ngayon ay nagre-register ng 109 deaths per day. At itong pagtaas ng deaths per day na to ay naka-reflect, no, sa ating mortality curve, where upon the end of July, we really saw an increase, no, in our deaths. Initially, it was actually in Region 7, which are the orange bars. Subalit more recently, nakikita natin, no, na tumataas na siya sa NCR, which are the blue bars, and of course, Calabarzon, which are the violet bars. Pero, lang natin, no, sa pagtaas ng kaso, mayroong karampatang pagtaas po talaga ng ating mga deaths. Pero yung tanong na, mas marami ba, no, sa mga cases po natin ay nagiging deaths ngayon? Actually, kung napapansin nyo, even with the increase in cases this year, our cumulative CFRs have actually been maintained at 1.73. And our analysis of that is that, you know, even with more cases, yes, we will see deaths, but the proportion of deaths to those cases is not higher than what we're seeing in the previous year, no? So hopefully that's the result of improvement of our critical care capacities, improvement in health-seeking behavior, as well as yung how we manage, no? Our clinicians are giving feedback na, well, at the start, of course, we all grappled on how we're treating, no? How we should treat our cases. Right now, there are already clinical practice guidelines in place that better guide our clinicians, our health workers, on how we should be managing our COVID-19 cases. So, just a last reminder, so tayo ngayon ay bumaba na po sa MECQ. Subalit, ang panawagan pa rin ay yung paglimita ng mga unnecessary travel as well as non-essential gatherings. No? Nakikita natin na while transmission is mostly in our households, meron pa rin nangyayari sa mga workplaces. Kaya napakahalaga nung pag-avoid ng gatherings in our workplaces, be it because of meetings, break time, or even meal time, no? Ikalawa is nabanggit natin kanina ang halaga ng agarang paghahanap at pag-isolate ng mga kaso. So, yung panawagan na kung tayo ay nakaramdam ng any sign or symptom, kung tayo ay naging exposed, please isolate yourself, contact your BHERS, your healthcare worker, to inform them so that you can be advised if you need to get yourself tested, and kayo ba ay i-isolate, kailangan ituloy ang inyong isolation. At ang pinakahuli ay ang ating pagpapaalala na ang pag-combine ng ating minimum public health standards at pagbabakuna ay ang mga effective pa rin nating pamamaraan upang tayo ay una, hindi magkaroon ng COVID or ma-minimize ang tsansa na tayo magka-COVID at ma-minimize din ang tsansa na kung tayo po ay infected na maipasa yon at na-transmit yun sa iba. So yun lamang, and thank you.
So thank you, Doc Thea, for your presentation. And based from the presentation ni Doc Thea, na you will see talaga additional cases in the following days. Pero syempre, may magagawa tayo, and the MPHS is still our best defense nga. Kaya mag-face mask tayo, hugas ng kamay, physical distancing, at umiwas sa mga kulog na lugar. Syempre, yun nga, magpabakuna kapag tayo ay eligible na. So let's move on po to the open forum, and remind ko lang po na 2 questions lang po tayo to limit so everyone can ask their questions. And If may time pa, let's have another round. So for the first question, let's have Red.
Hi po, good morning Doc Thea, good morning po, good morning Cholo. We've been dodging this question, the DOH been dodging this question all time long. Pero can we confirm it officially? Are we in a surge?
Red, alam mo, I don't think it's a dodge, no? I think the statement of DOH is we don't use the term surge, no? As an epidemiologist, wala tayong konkretong definition kung ano ba talaga ang surge. In fact, there are different interpretations. Some would say a surge will be an increase in cases. Yung iba sasabihin nila, ay hindi lang dapat increase ng cases. Dapat sinasabayan siya na na-overwhelm ang ating mga healthcare facility. Kaya sa facility, they use that term, surge capacity, kung narinig nyo. But what we can say is yes, no? The term we would like to use is yes, there's an increase in cases, and we want to be able to quantify that increase that we are relaying. And the way we are quantifying it is by describing it in two ways. Number one, gaano ba kabilis o kalaki ang pagtaas ng kaso, and that's our 2-week growth rate. At nakikita natin ngayon, no, umaabot tayo ng 63% na 2-week growth rate nationally. At ang ikalawa, gaano ba kalaki sa population natin ang affected? And in epi terms, that's the attack rate. That's why we use naman ang ating average daily attack rate na sa ngayon, based on our cutoff thresholds, tayo ay naka-high risk na ADAR. No? Kaya pag kinwas-tabulate natin, we try to quantify and describe that increase through our risk classification. And nationally, nakikita natin naka-high risk case classification tayo.
Okay, at least klaro tayo. And number two, na-confirm po ba ng DOH yung sinabi ni Father Nick nung Go Negosyo Forum that the Delta variant escaped daw po from Cebu and it became prevalent daw sa Mindanao. Kasi doon daw, kaya daw po nagkakaroon ng increase ng kaso doon sa Visayas and Mindanao is because of may nakawalang isang positive case sa Mindanao or sa Cebu, and which caused the infection in the region. As opposed daw po doon sa Delta sa Luzon na parang iba raw po yung sinasabi po niya, iba raw po yung anak nung Delta sa Luzon at iba raw po yung anak nung Delta sa Visayas and Mindanao. Can we confirm it po yung sinabi ni Father Nick po nung Monday? Salamat po.
Red, I cannot confirm because we don't have such info. Lalo na yung term na kung may nakatakas. I think what we can say is that based on what we've seen, no, ang mga BOCs naman natin ay hindi nanggaling sa loob. No? Siya ay nanggaling sa labas ng bansa, nakapasok dito. No? Kung saan siya dumaan, yan ang hindi natin definitively masasabi. No? Kasi ang dami nating ports of entry. No? Meron tayo dito sa Maynila, meron tayo sa Visayas, na posibleng pagpasukan. No? But sa atin kasi, ang mahalagang impormasyon ay indito na siya. No? And we knew that even as we want to continually strengthen our border protocols, there must be components of that border protocol in our ports of entry na kailangan pa nating paigtingin. No? Kasi we know potentially this will not be the last DOCs that we will see. No? Kaya yan yung pinapaabot natin palagi na kailangan first line of defense, no, door one natin are bans. We have bans now, but it cannot be prolonged. Kaya kailangan talagang palakasin is door 2 so that we can avoid bans. But at the same time, doon pa lamang sa port of entry, makikita na natin, mas-screen na natin, at kung hindi man natin malaman agad, no, hindi naman natin nakikita agad kung may Delta o VOC ang ating mga international travelers. Kaya meron tayong quarantine protocols in place. At yun ang ating panawagan, hindi lamang, no, sa ating BOQ or TGMROF, pero doon sa mga LGUs kung saan ine-endorso natin ang ating mga incoming international travelers after finishing that 10-day quarantine. So I think that's the best way to describe kung paano ba, no, nakapasok, and of course the transmission happened locally because alam natin how very fast, no, and more transmissible Delta is.
Okay po, sige po. Salamat po, Dr. Salamat.
Thank you.
Next question, let's have Caroline.
Hi, ma'am. Good morning. Ma'am, if NCR's growth rate and ADAR are slowing down, saan po possibly manggagaling yung karamihan ng mga cases na ine-expect natin in the next weeks? And also, how high po yung ine-expect natin na peak? Gaano karaming cases? Thank you.
Thank you, Caroline. No? So, hopefully nga yung slowdown na nakikita natin ay tuloy-tuloy. Pero posible pa rin kasi ang term ko ay pumalo pa siya pataas habang nire-ramp up natin ang ating active case finding, ang ating contact tracing, not just in NCR, but in all areas that we're seeing these cases, increasing cases. Kaya kung wala tayong isang specific area, you know, the increase in cases can really come from any and all areas here, no? At nakikita nga natin ngayon, 10 regions, actually all regions have positive 2-week growth rates already, no? So talagang this is something na nakikita natin in the next few weeks na posibleng tumataas pa yung kaso. Pero ang ating palaging pinapaabot ay if they ramp up these activities now, after that slight increase in cases, we should be seeing a slowdown approximately 2 to 3 weeks after. No? Kasi nakikita mo na-isolate mo na. In the projections, nakikita natin, no, may range tayo na posibleng makita. No? Sa ngayon, I think the lowest was around 66,000 active cases by the end of August. Pwede tayong umabot ng almost 80,000 if I remember correctly, no, by the end of August, no. So yun ang pinaghahandaan natin. Actually, ang mahigit nating pinaghahandaan ay hindi lamang yung pagdami ng kaso, pero ano din yung sinasabi ng projections na ilan kaya yung posibleng severe at critical cases natin na nangangailangan ng mga kama sa ospital. So yun ang ating naipaabot para naman kung ano ang dami ng critical cases by end of August or by end of September. Ang ating one COVID referral center ay tuloy-tuloy na dinadagdagan ng ating mga ICU beds. At yun ay nakita natin. Across a week, we were able to add 100 more ICU beds in NCR. And hopefully in the next few days, tuloy-tuloy natin madagdagan yun so that critical care capacity will not reach full capacity.
Yung proportion po nung severe and critical cases dun sa total number of cases, is it increasing po, yung percentage?
Sa ngayon, base sa aming case line list, hindi natin nakikita na lumalaki siya, no? It's just under 2%, no? On top of that, isang tinitingnan din namin ngayon na yung ating mga admissions. Nakikita natin na oo, dumadami po talaga yung admissions natin, subalit yung proportion no, na nagiging critical ay hindi nagbabago, no? Parang ginagawa namin analysis nun sa per age, whether case or death. Dumadami, pero the contribution of each health status, the symptomatic, the mild, moderate, severe, and critical, hasn't really changed. But of course, kailangan namin tuloy-tuloy na bantayan yon para kung meron mang pagtaas, no, bigla ang pagtaas tayo makita, yun ay ating ma-address agad.
Thank you po.
You're welcome.
Dr. and Caroline. Next question, let's have Greg.
Good morning po. Doc Thea, quick follow-up lang po dun sa pag-peak of cases. I might have missed this earlier, pero do we have an estimate as to when could we possibly see the peak? I mean, factoring in the incubation period. Ano po ba ito? 2 weeks after the end of the ECQ? Baka mag-peak? Parang ganun po ba?
Actually, so, answer the question. Ang hirap sabihin, no? Pero it's possible, yes, it might peak in the next 2 weeks. Pero sa ngayon, I would not be comfortable telling you when. Bakit? Napapansin namin kada linggo, nagbabago talaga yung numero natin. Kasi kailangan namin i-factor in na ano yung ginawa ngayong linggo. No? At makikita natin kung ano mang epekto niyan in the next week. So sa ngayon, though there might be some slowdown that we're already seeing, yung linggong ito magde-determine ulit kung anong makikita ko 2 weeks after. So yun, I cannot give a definitive answer right now when we will peak. But I think, again, what I'm also trying to relay is cases will increase. But one thing we'd like to closely monitor then is yung nabanggit kanina, are the severe and critical cases in terms of proportion to the total cases increasing unusually? And then number two, looking also at our mortalities. Pwedeng madami tayong kaso. Pwedeng mag-peak pa tayo in 2 weeks, 3 weeks. Pero kamusta yung deaths natin? Masyado rin bang tumataas ang kanyang total deaths in comparison? So the proportion of deaths among our cases.
Alright, Doc. Doc, taking off from the deaths po, no, we've reported may increase sa mortality. Pero may data po ba tayo kung ilan sa kanila yung, or maybe percentage ng vaccinated and vaccinated? Maybe to show lang po how helpful so far sa vaccination against possible deaths po. Thank you.
Salamat sa tanong, Greg. Yan ay, tayo ay meron ng sinimulang analysis for that, pero we need to vet that analysis, and we'll share it as soon as we have, but para nga makita natin what's the effectivity of vaccines in terms of preventing severe and critical illness and our deaths. Sa ngayon yan ay datos na hindi pa available locally, pero I think we all do know that that is the purpose of our vaccines talaga, no? It may not completely protect us from infection, but other studies outside of the Philippines have shown that they are really effective in preventing hospitalization and death. So once we have that analysis available, we'll be more than happy to share it to our media friends.
Alright, Doc. Thank you po. Thank you, Sir Jolo. Thank you.
Thank you.
Yeah, so let's have Nika muna bilang nag-send siya sa chat kanina. Nika.
Hi, Doc Thea. Good morning po. So, i-share ko na lang, yung questions ko po, mag-focus po siya dun sa misinformation that's spreading online about RT-PCR testing. Meron po kasing posts na nagsasabi na kaya tumataas yung cases natin is because inaccurate yung RT-PCR testing. So, yung first claim po kasi niya is gumagamit daw po ng universal primer sa coronaviruses. Kaya maski ordinary flu, nagiging positive sa RT-PCR. So, the first question, can you explain po what a primer is and how is it used in RT-PCR testing for COVID-19? And does that, can you explain why this is true or false po based on what you already know about RT-PCR?
Sige, Mika, magiging honest ako. This is not my expertise. I can't explain what a primer is, but I can relay what I do know about how PCR testing is being done, no? So, yung claim na siya ay nagde-detect ng lahat, no? Aside from SARS-CoV-2 and even the ordinary flu, mali siya, no? Sa pagkakaalam natin, ang ating mga PCR test ay dinisenyo specific para sa SARS-CoV-2. At yun ay nakabase sa spike protein, no? Ito yung parte ng virus na dumidikit, no? Siya yung nagsistick sa ating cells at dahilan kung ba't pumapasok siya sa mga cells natin at dumadami siya doon. So it is very specific for that. In fact, ang isa ring kagandahan ng ating mga PCR test is while it is specific enough, no, to detect the SARS-CoV-2, in a way it's like general enough and has the capacity to still detect that virus even with the mutations, no? Remember, itong mga variants of concern, nakakaroon ng pagbabago sa genetic characteristic ng ating mga ng virus. Pero kahit na nagbabago yung genetic characteristic, no, yung may mutations nang nangyayari, dahil ang tinarget niya is that part of the virus, nahahanap pa rin natin siya. I'll have to get back to you about the universal primer. I'm not really well versed on that, but so far what I can say that the kits have been tested. It has achieved the specific term namin sensitivity and specificity ng mga percentages para masabi natin confident tayo that it can detect SARS-CoV and that when we say that PCR test is positive, talagang SARS-CoV yung sinasabi natin positive and not another virus.
Thank you po. Quickly lang po, as a second question, sabi kasi niya na hindi nga medically sound yung RT-PCR. So does that mean na yung higher number of cycles that an RT-PCR runs for runs yung cycle threshold means higher chances for it to return a false positive result.
Nika, ay intindi natin sa cycle threshold, no? Well, the way it is interpreted is a cycle threshold just means na as it goes higher, the load, the viral load, no, is lower. Pero kailangan tandaan natin, bawat PCR test ay merong kanya-kanyang sinet na cycle threshold. Para lang pag nagpapatest tayo ng CBC, di ba? So pag nagpatest ako sa laboratory na to, yung parang reference value ko, para masabing positibo ako ay pwedeng iba doon sa ibang laboratorio na gumagamit ng ibang kit, no? Ganun din sa PCR, no? Posibleng meron tayong mga PCR kit na nag-a-allow na ang cycle threshold hanggang 40 ay positive, yung iba naman hanggang 30. But I'd like to go back na ito naman ay dumaan sa validation ng RITM, ito ay sinertify, no, ng ating FDA. So yung sabihin, pumasa siya, no? And it's again sensitive enough to say na talagang pag positibo ka doon, positibo ka talaga sa SARS-CoV-2 and you're confirmed as COVID case.
Thank you po. Thank you, Sir Jojo.
Thank you, Nika. Next question, let's have Aiko. Aiko.
Yes po, good morning po. Good morning, Dr. Thea. Dr. Thea, over 60% of the sequence samples reported early this week are Delta variant cases. Can we now say that Delta is the dominant variant in the Philippines? And when can we officially announce that we have the community transmission of the Delta variant? PGC early this week also announced na meron na nga po, but what are the factors that like DOH is considering why we can still until now declare a community transmission of the Delta variant?
Okay, sige. Thank you, Aiko, sa tanong, no? When it comes to predominance, if you remember the graph, no, I showed earlier, nakikita talaga natin sa bawat sample run, karamihan talaga dito ay kung hindi delta, ay mga alpha at beta. But the reason why there's caution at our end, kung bakit ayaw naming magsabi na, predominant ang delta, predominant na yung VOC sa ating sample run, is yung term ko kanina. The sampling methodology that we employ is very biased towards detecting the VOC. Inuuna natin at pinaprioritize nating masama yung mga lugar na may pagtaas ng kaso, yung mga severe critical natin, yung mga may possible reinfection. And these are the populations which have a higher likelihood of testing positive for a variant of concern. At yun nga yung nakikita natin. Moving forward, now that we have more available kits, we have started doing representative sampling, meaning hindi lang tayo nakatutok doon sa mga may pagtaas ng kaso, pero alam mo yan, kahit walang pagtaas ng kaso, sasama natin yung samples sa lugar na yun para makita natin ano ba yung tunay na prevalence ng mga VOCs. And with regards to the second question on community transmission, in a few days back, we did confirm, no, that there is community transmission in the National Capital Region and in Calabarzon. Balik natin, no, sa definition, sa ginagamit nating basihan, ito ay una nakakita tayo ng malaking, no, a large number of cases. So in this case, these are cases positive for Delta. And after reviewing the case investigation, what we call the phylogenetic analysis. The phylogenetic analysis is like linking, no? Pinakikita niya yung linkages ng mga kaso base sa genetic characteristic nila at base dito sa case data natin sa phylogenetic analysis, nakita natin, no, karamihan, actually halos lahat ng mga local Delta cases sa NCR at sa Calabarzon na hindi na natin nalilink. Hindi sila konektado to each other. They didn't have the same exposure. They didn't know each other at all. They came from different places. And at the same time, no, when we ask our cases, sino po kaya yung nakahawa sa inyo? Kanino nyo po kaya nakuha yung infection na to? Meron ba kayo nakasalamuhang incoming international traveler? Kadalasan ang sagot ay hindi na namin alam. Hindi namin ma-determine kanino at saan natin nakuha. And those were the basis for declaring community transmission. it will be very difficult to declare community transmission nationally. Remember, we have 17 regions, and each region will have differing profiles in terms of Delta transmission. Kaya naman nabanggit na nating press release na pinag-aaralan pa natin, no, sa ibang lugar. Pero yung huling punto ko na lang ay meron mang community transmission, predominant man o hindi, ang Delta or any other VOC in our country, upon detection of these VOCs locally, we have put these responses in place. So there is no change in the response entailed kasi whatever necessary response is needed kung merong community transmission, yun ay pinanimulan na natin.
Ma'am, clarification lang po. So, you've said na hindi nationally we cannot declare yet community transmission, but in regions like for example NCR we can. Ano po yung parang pinaka main factor why we cannot yet declare it as it is nationally po?
As mentioned, no, iba-iba rin eh. Kung makikita mo, meron pa tayong rehiyon, no, na hindi pa natin nahahanapan ng Delta case. Meron tayong region, isang Delta case lamang, no? So, I think it's very difficult to declare it on a national scale. But in any case, it's more easy for us to make that determination at a smaller scale, no? I think even WHO, when they try to classify countries, no, one of the things they're looking at is not just declaring, for example, the whole country in terms of just COVID-19 cases as having wide-scale community transmission. We've always believed that you can't look at it as a whole. We are an archipelago. There are differing statuses at each point in time in our country, and it will be more useful to the country to look at it at the least at a subnational level.
Okay po, Doc Thea. Thank you po, Jolo. Thank you, Doc.
Next, let's have Rafael.
Good morning, Doc Thea. Yung active case finding po kasi yun yung pinapanawagan talaga ng DOH na sa mga LGU na pagbutihan pa. Paano po natin na monitor or na measure if nagagawa po nila ito? At may mga LGU po ba na nakikita ninyong nahihirapan sa paggawa ng active case finding? And if you have the records po siguro, can you identify these LGUs?
Salamat, Rafael. No? Parte ng ating crisis action plan ay ang pagmamonitor, no, ng ating mga LGUs na naka-under alert level 3 at alert level 4 at ang pag-conduct nila ng active case finding. Ito ay nababahagi under the community cluster being headed by the DILG. I don't have the most recent report right now. I think at the start talaga, it was very challenging. Why was it challenging? At the LGU level, there are a lot of response activities going on, no? So sila ay naghahanap, nakakaalam, no? Nalalaman nila na may kaso sila, nag-isolate. Sila ay nagbabakuna, sila ay nagtatransport at nagre-refer ng mga kaso. At ngayon tayo ay humihiling nga, no, na gawin nga nila yung Darabi model na as in actively house to house, no, maghanap ng kaso. Kaya yung na-suggest at ito yung naging parang facilitate naman ng ating community cluster na bigyan sila ng assistance in terms of guiding them on how they should do it. Dati parang ang contact tracer natin may not be teamed up with our disease surveillance officers, but right now that's the approach of the DILG. It's a team of people who will look for cases and then actively and then quickly makapag-contact trace tayo. And since we have additional antigen kits, this may already be used so that we can already identify, no, sino yung positibo sa antigen at ma-isolate. DILG also is augmenting, no, especially yung mga contact tracers natin. At sila yung tumutulong din, not just in contact tracing, but also in actively looking for these cases.
Sige, ma'am. Tapos ito, ma'am, baka lang po mabigyan nyo rin ng sagot kasi may mga worries po yung ilang mga non-COVID patients on how they can access healthcare, especially now that hospitals are announcing that they're at capacity. So, and by non-COVID po sila yung mga cancer patients, tsaka yung mga those needing therapy, which are also emergency cases naman din na maituturing. Can you just give them an idea on what they can do po para hindi maapektuhan yung kanilang pangangailangan ng access to healthcare?
Rafael, salamat. Napakahalagang paalala yan, no? So, kaya tayo, isang pagpapaabot na ginagawa natin ay ano ba yung mga COVID referral centers natin na kung saan purely COVID lamang ang kanilang i-cater to. Pero tama ka, no? Isang mahalagang pagpaigtingin pa ng ating departamento at mga region ay yung pagpapaalam, no? Saan pa ba yung mga services? Saan pa ba yung network para sa non-COVID? Yan actually yung isa sa ina-address natin. Nakita natin nung tayo nag-peak noong April na nagkaroon tayo ng difficulty, no, lalo na sa mga naghihemodialysis or gusto mag-access ng iba't ibang services. And we're discussing this with our health facility cluster. Thank you for that reminder. We'll give an update on that. But para natin mas mapapaabot, no, publicly yung ating mga other essential services.
Okay, thank you, Rafael. So short lang, Alay.
Doc Thea, kung naiiwan po sa around 1.7 yung ating CFR, could this also mean na hindi nagdudulot ng mas severe disease ang Delta variant?
Mahirap sabihin, paano ko ba sasagutin? Sa ngayon, ang mga sinasabi naman ng nakikita natin sa ibang bansa, tumataas ang hospitalization, pero yung nakikita natin, tataas ang hospitalization kasi dumadami of course yung kaso. Sa ngayon, base, no, doon sa ating mga nahahanap na Delta cases, hindi tayo nakakakita ng higher rates of severe or critical disease. Remember, of the 1,200 natin na 273 natin na Delta, less than 2% ay mga fatalities. No? So as of now, we have no evidence that Delta is causing less or more severe disease. No? Nakikita natin severity is still related doon sa either sa age mo, because you're from an older age group, you have comorbidities, or unfortunately, if you will seek consult later, then that might affect how severe yung disease na magmamanifest sa atin.
Tapos Doc Thea, could you comment on this? May nagsabing prominent microbiologists from Hong Kong na with the emergence of the Delta variant and vaccinated people getting infected, yung threshold for herd immunity has greatly increased and may be harder to achieve. And yung second po, yung US CDC, sinabi din po nila na the SARS-CoV-2 could just be a few mutations away from evading vaccine.
Okay. Take into consideration naman natin yung epekto ng ating mga variants of concern on what we call herd immunity. No? So, ang herd immunity kasi, for me, it's a complex na konsepto. It doesn't just talk about, when you want to compute it, you need to take into consideration not just yung scope, no? Gaano ba karami ng population mo yung dapat mabakunahan, pero may dagdag na factor yung tulad nito, how much less efficient will the vaccines be because of the variants of concern. And also sa tingin ko yung dulo, how long will the immunity last, diba, after you're vaccinated? So right now, I think everyone is still studying, ano ba talaga yung herd immunity? But the goal is to get as many of our population fully vaccinated as possible. And that's why the goal right now is to increase that to a point that while we may not be able to reach herd immunity, then at least we use the vaccines to lessen and to reduce severe and critical cases and our deaths.
So thank you.
I have to.
That's all of the time we have for Kapihan.
Thank you po.
So, Dr. Closing message na lang po, Dr.
So again, it's always a pleasure to have this Kapihan with our media partners. I hope that with this Kapihan, una, nasagot natin yung dapat sagutin, no? So ang DOH naman, it's always been there to tell you what's going on, no? But I guess ang mahalaga din ay yung pagpapaabot ng impormasyon na hindi lamang sa tama, pero yung alam natin ano yung dapat natin gawin. So we're not helpless. Yes, cases are increasing, pero there's still something that we can do. We may not see it now immediately, but we will feel the effect of whatever ambag natin individually or by LGs and workplace in the weeks to come. So, yun lamang po. Mag-ingat po lahat and thank you very much.
Thank you, everyone. That's it for Kapihan today. Thank you, everyone. Thank you, Dr.
Thank you.